One of the beauties of the Vasyli foot orthotic device system is the ability to modify the device. Certainly the ability to heat mold the shell gives us a much more congruent posture to the foot as well as a nice interface for the ground. But with that we sometimes need balancing in the form of posting. One of the most common areas to get excessive motion has to do with the rear foot and the heel moving into excessive pronation. So when we see this and we want to go beyond the normal support of the device, we can add additional correction by placing a rear foot post against the arch profile, and depending upon the length of the device, we may have a bit material left over, but we line this up on the medial side of the arch profile at the very proximal end, and then just extend that around. You may see that this then extends a little beyond the shell of the orthotic device, and that can simply be trimmed with scissors to make it congruent and flush with the end of the orthotic device. The problems are not always in the rear foot, however. There are some folks who have late pronation, things such as a forefoot varus, where we need our control closer to the front of the foot. So a forefoot varus post is going to be thicker on the arch side and thinner as it goes out to the outside. The placement of the post should be right behind where the first metatarsal will hit, so that the end of the device would be placed somewhat like this, so that the medial edge of the device is flush to the medial border of the device, and then the adhesive is removed and the device is simply placed across the foot so that the foot can still bend freely in the forefoot, but is supported just behind that by the forefoot post. You may see there also will be a little bit of extra material that can be again trimmed with simple scissors to make a nice flush contour to the medial profile of the device against the shoe. Now, some folks have a supinatory problem and have a tendency to roll to the outside, so we do also have lateral posting. This would be placed behind the fifth metatarsal head and again placed flush against the lateral side so that it does not interfere with the natural toe break but still supports the metatarsal or forefoot region and keeps the foot from moving to the lateral side. Two other corrections that we can make through the device are a heel lift and metatarsal raises. The heel lift can be placed in the rear of the device to raise the device a bit higher in the rear foot than the forefoot. This is used for a variety of conditions. This can be used for leg length correction as well as someone who has an unresolved equinus influence of their ankle, meaning if they have an ankle that simply doesn't have enough dorsiflexion, by placing the heel lift on the device the way that we have here, that allows the ankle to function in a position of more plantar flexion. Obviously with leg length we would want to try to make sure how much correction we want. One of the nice things about the Vasyli heel lifts is that you can vary the correction by where you put the device. If we want the full correction, we put the heel flush with the device. If we want a bit less, we simply move it backward and then we trim this excess material off the end. The final addition to the foot orthotic device that can be useful is an extra support to the metatarsal area. This is a metatarsal raise, and again the adhesive backing would be removed, and this would be placed on the orthotic device so that the front edge actually fit flush with the edge of the device. This creates a nice metatarsal raise which supports the shafts of the metatarsals, creating a bit more of a doming to the foot and relieving some of the excess pressure that often occurs in the metatarsal area.